When we think of oligometastatic prostate cancer, well, first of all, if you take a step back, radiation has been thought to kind of turn tumors, or basically change the tumor microenvironment and make it more immunogenic, or just make it more immunologically, we call it immunologically hot. So there are some tumors that just are naturally like that, and prostate cancer is known to be more immunologically cold. However, radiation, especially SBRT, may play a role in turning a tumor that is cold into a hot tumor, and then that actually may be the reason why patients respond really well to radiation therapy. There's something called the abscopal effect, which may or may not be a real thing, because it's really hard to understand. It's rarely observed, and it's observed occasionally. So anyway, but one of the thoughts is that radiation can basically change the tumor microenvironment, make it very favorable, and then there's even a potential that radiation may change the tumor microenvironment so that you might be able to introduce something like an immune checkpoint inhibitor at a certain time and actually really have an exceptional response to therapy. But we need to really first understand how radiation changes, the peripheral immune system, like basically the tumor microenvironment and peripheral immunity. So that's what the poster is looking at. So basically in patients that were oligometastatic, they had oligometastatic prostate cancer, what we were doing after their treatment with SBRT, well, we took baseline blood samples. It was baseline, it was immediately post-op, and then we also took blood samples at 3 months post-radiation and 6 months post-radiation, and we performed cytoph analysis on the PBMCs, and we were looking for just any type of markers, just changes in the immune microenvironment, tumor immune microenvironment, just to see what might be going on, what is radiation doing. We saw some exciting changes. This is a small study, it's a pilot study, 14 patients, but obviously with all those time points, and so what we're seeing already is a lot of CD4 T cells that are activated, particularly post-radiation, and in some of the we also looked at patients that eventually recurred versus did not recur after this treatment, and in the non-recurrent patients we also saw some exciting changes that we were not seeing in the recurrent patients that actually lasted a little bit longer past the immediate post-op period. So that suggests that, again, radiation is clearly doing something. It's changing that tumor microenvironment in a positive way, and that maybe that's the reason why some patients are actually do fine or do really well long term compared to the patients who recur more quickly. The next step in that analysis is that we're getting additional information. So we did TCR sequencing. We're looking at proteomics, and we're also looking at just some tumor genomics, just to see if there's anything about the baseline tumor that can predict for the responses that we're seeing, or the types of responses that we're seeing even in the peripheral blood.